According to World Health Organization, coronaviruses are a large family of viruses that cause illness ranging from common cold to more severe diseases such as Middle East Respiratory Syndrome and severe acute respiratory syndrome. Coronavirus disease is a new strain that was discovered in 2019 and has not been previously identified in humans. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Detailed investigations found that SARS coronavirus was transmitted from civet cats to humans and MERS from dromedary camels. Several known coronaviruses are circulating in animals that have not yet infected humans. This virus is thought to spread mainly from person to person between people who are in close contact with one another, within 6 feet approximately. It transmits through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouth and noses of people who are nearby or can possibly be inhaled into the lungs. As of March 19, more than 219,548 people have been infected in more than 80 countries. 118,380 patients have mild conditions, while remaining 6,816 are in critical conditions. If we consider outcomes of the virus, so far 94,748 patients are suffering from the infection. 85,789 people have recovered and 8,979 deaths have globally been reported. Just over 3,000 of those deaths have occurred in the mainland China. Analyzing the statistics, we can conclude that the recovery rate of patients from the infection is around 90%. As the coronavirus spreads throughout the world, health officials are repeatedly assuring the public, your risk of getting seriously ill or dying is very low, unless you are older or have an underlying condition. The people aged 70 or older regardless of medical conditions are at greater risk if infected. People under 70 with an underlying health conditions as chronic respiratory diseases such as asthma, chronic obstructive pulmonary disease, emphysema or bronchitis, or chronic heart diseases such as heart failure should consider coronavirus as a dangerous thing. People with chronic kidney disease, chronic liver disease such as hepatitis are also vulnerable. Chronic neurological conditions such as Parkinson's disease, motor neuron disease, multiple sclerosis, a learning disability or cerebral palsy, and diabetes have potential to cause serious problems if infected by coronavirus. Problems with your spleen, for example, sickle cell disease, or if you have had your spleen removed, can also create problems. A weakened immune system as the result of conditions such as HIV and AIDS, or medicines such as steroid tablets or chemotherapy, and being seriously overweight are also at risk, whereas pregnant women should be extra careful too. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Reported illness have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease 2019 cases. If you develop emergency warning signs for coronavirus, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs, avoid close contact with anyone showing symptoms of respiratory illness such as coughing or sneezing, There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in public place or after blowing your nose, coughing or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% of alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose and mouth with unwashed hands. Avoid close contact. Avoid close contact with people who are sick. Put distance between yourself and other people if coronavirus is spreading in your community. Take steps to protect others. Stay at home if you are sick, except to get medical care. Cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% of alcohol. Wear a mask if you are sick. If you are sick, you should wear a face mask when you are around other people and before you enter a healthcare provider's office. If you are not able to wear a face mask, then you should do your best to cover your coughs and sneezes, and people who are caring for you should wear a face mask if they enter your room. If you are not sick, you don't need to wear a face mask unless you are caring for someone who is sick. Face masks may be short in supply and they should be saved for caregivers. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Most common household disinfectants will work. Use disinfectants appropriate to the surface. Friends, if you liked the video, please give it a thumbs up. Subscribe my channel and hit the bell icon so that I can reach you with more interesting videos.